The idea is to be able to do transplant for patients who do not have a family donor or a donor in international registry. And what we are doing is actually doing what we call haplotransplant with a donor that's only half matched with the patient. And what we have been able to achieve is to give the patient cells from the donor from which we have eliminated those cells that cause the rejection, that cause a reaction of the donor cells towards the patient and which could actually kill the patient. So what we have done, we're doing a stem cell transplant with these people. We're giving them a stem cell graft and then adding to that an immune graft where we're reconstituting the immune system. And these cells are able to fight the leukemia, and they're also able to fight the infections. However, they do not recognize the patient as foreign, so we do not have severe graft versus host disease, which is the term for the rejection. And what is extremely interesting is that we are aiming at doing this without giving drugs to prevent the rejection. So it's only the treatment of S cells that allows us to do this strategy. So what we have done, we had already done a phase 1 study where we had escalated the number of cells that we have administered to patients. And in the current study that has been presented, we have shown results on 23 patients, so a phase 2 trial for which we have just completed, and for which we have very interesting results and that are really in line with exactly the first study that we did, where these patients are doing very well. We're seeing good engraftment, and we're not seeing severe graft versus host disease. So we're very excited about these results. Currently, if you have a bad leukemia, if you need a transplant for treatment of leukemia, we would normally look for a family donor. So we can find a family donor in approximately 1 in 4 patients. So 25% of the patients have a donor. If you don't have a family member that's compatible, then we go to the international registry. And in the registry, we can find another 25 to 30% of the patients who can find a donor. But still, we're left with a large number of people who do not have a suitable donor. And therefore, we want to use this strategy, the haplotransplant strategy, to do this. Interestingly, there are a few options for these patients. You can use umbilical cord blood transplant, which is interesting. However, there's a limitation. For example, if you're an adult and you need lots of stem cells, well, you may not have sufficient numbers of cells to get good engraftment. Also, there are some issues with the graft itself and with the time to take. So there are some limitations, especially for adults, limitations which are not found, for example, in the pediatric population, where we get enough cells to do transplant in kids. So this option offers a way of regenerating an immune system and fight infection, fight leukemia, but actually don't encounter the problem associated with administration of drugs to prevent the occurrence of graft versus host disease, the rejection by donor cells of the patient cells. The major challenge is really to be able to identify those cells that are recognizing the patient. And the strategy that we have developed is very interesting, and now we have been able to develop a process that's very robust and reproducible. So the manufacturing of the cells is a crucial element, and now we have mastered a strategy that allows us to really have very good, consistent grafts, and that's has been quite a challenge, and this has been successfully achieved. So we're very happy about this achievement. And the results of the study, I think, are exactly in line with the fact that the cell products are really of high quality. The next step, we are embarking right now onto a second phase 2 trial where we will actually administer 2 doses of these cells, because now we know that these cells are not recognizing the patient, they're not rejecting the patient. So now we want to have better effect to fight the infections and fight leukemia. So we're giving 2 injections of the cells, which is going to be, we think, a significant improvement in a strategy that's already very exciting. So that's the next step, and after that we want to go on to a phase 3 trial to really confirm the efficacy on a broad application and get access to the market.